What's up, everybody? I am super excited to have Dr. Peter Martone here to speak to us about your role and how your sleeping position impacts spinal health. Let's be honest, all of your patients need to be educated on this. I have to be educated on this on a regular basis. I'm pretty sure that I wrestle invisible dinosaurs in my sleep sometimes. My sheets are a mess and my back is always hurting, or my neck. And I'm sure I'm fixing to learn exactly why that is today. But I'm super excited because Dr. Martone was introduced to me from my dear friend, Dr. Fab Mancini. And Fab was like, he is the man and the expert when it comes to helping patients get the best rest. And so I'm so excited to hear what he has to share with us today. In addition to being a chiropractor and helping patients for the past 20 years, he's also the inventor of the neck rest, which is a revolutionary new pillow designed to improve your posture while you sleep. I'm all about, multitasking, especially when I'm napping.
Yeah, exactly right. The best biohacks are what you can do when you're doing nothing. It's awesome.
I love it. Well, I'm going to go ahead and let you take it away.
All right, fantastic. I am so excited and so super pumped. I am, again, thank you so much, Dr. Peter Martone. And I have been focusing and I really have been zigzagged into this sleep world. This is really going to be the first time that I give a presentation in this type of forum. I've done many Zoom calls, but not really webinar type-ish Zoom calls. So we're going to get started. I'm going to share my screen, and I'll jump back and forth from screen to me. I just think I want to be a little bit more interactive, going to be really conscious on time, try to really be around that 30 to 40 minute time frame. And we're going to jump into this. So let me come over here. I'm going to share my screen, and I click this thing, I share it, and now we are going to click up on my PowerPoint here, and I am going to start it from the beginning. All right, so this is me and my beautiful wife. Actually, we just had our anniversary last night, so this was us. Oh, what's the heck? No, remind me tomorrow. And then, so this is us when I graduated school. And if you can see down in my hand, right when I zoom in there, you might not be able to make it out, but you can see my pisiforms were on fire when I was graduating. Hold on one second. Oh man, I'm trying to do this here. All right. So my pisiforms were on fire. And what I mean by that is when I graduated school, we're going to try to come down here. I'm going to go back and forth on stop sharing and sharing. So when I graduated school, I was so fired up. I was so fired up to be a chiropractor. I wanted to go out there and I wanted to change the world like all of us do. And I got out there and I started doing spinal screenings, which is fantastic. I love that. Anything to really educate the public. So I was doing spinal screenings. And what I found is that the patients that I was attracting were pain-based patients. So I would be bringing in a patient, and that patient right out of school would have, they would have lower back pain. I was so excited. I'd say, the power that made the body heals the body. And when I adjust you, the light's going to be turned on. And they're like, Doc, just fix my back. Just fix my back. I'm in pain. And then I would adjust them. And I loved it because they would get out of pain. They'd get out of pain quickly. And then what would they send me? They would send me more lower back patients. So I kept on. I'm going to go back to sharing here. I'm going to try to figure this out again. So what I did is I kept on pigeonholing myself. All right, let's go through it again. And I kept pigeonholing myself, and I ended up realizing that when I looked at my entire practice in my existence, this was 5 years later, I was set myself up for failure because I didn't identify my practice. I didn't identify who I was. So next thing you know, I'm this chiropractor, I'm an exercise physiologist, I'm a nutritionist, and I really wanted to make a huge impact in people's lives. But I found that I had a neck and a back pain practice that my PVA, for those of you that track it, was only about 8 to 12. It was only about what insurance covered. So I had an insurance-based, pain-based model. I was unfulfilled, and I had a little secret. I was working on patients so much that my entire body started to break down. I had back pain every day of my life. I mean, every day in my practice. I was getting adjusted, and I was getting adjusted on a regular basis. And I had this office filled with all of these back pain patients. And I myself had back pain every day. And it wasn't until 7 years ago when I really hit my lowest point. I hit my lowest point because I had a little bit of I'm a big mountain biker. I am a hang glider. I mean, I hang glide not regularly, but I have taken some crashes, big rock climber, and I'm really hard on my body until one day I took a little bit of a crash and I finally herniated my disc. I'm a chiropractor for 15 years, a little, maybe 14 years at the time, now 21 years. And I'm sitting in the emergency room. I'm hooked up on Dilaudid because I couldn't move. My leg was numb. This thing to the right was the first. I was on so much medication, and listen, I don't know your view of medication. I'm not a big medication person, but I was in so much pain. They gave me the Dilaudid and morphine, and I got so backed up, I had to use an enema. It was not a good place in my life at all. And when I was in the emergency room, I was thinking, I'm like, how could it get to this? How could I be a chiropractor working on people for so long, having this back pain clinic, really trying to pull myself out of it? And how did it get to this? Well, I reviewed 2,000 x-rays at that point because I knew that there was a pattern. I knew that there was a pattern that I needed to help people. And I knew that there was a pattern after looking at x-rays. When I'm adjusting people, people's spines typically look the same. They look the same, and I'm gonna kind of come out of here, and I'm gonna stop sharing. I'm gonna come back to me again. How do I do this now? All right, good. So turn screen share on. No, I'm gonna keep it up. All right, good. So I was adjusting patients, and I came up with this pattern. So, doc, when you're seeing things and you're looking at x-rays and you're looking at people and you're adjusting them on a regular basis, there's something that you're seeing, whether it's somebody sprains a right ankle. Actually, this is a good check for you. You can tell which ankle somebody sprained by having them turn their head to one side, turn their head to the other side. Whatever side they turn to less, they've sprained the opposite ankle. It's crazy. I have ADD like a maniac. So I look at patterns and I understand patterns and I see patterns. I can look at somebody now and I can tell them what position they sleep in. I can tell them if they have digestion issues just by looking at their alignment. So I knew that these patterns existed, and I'm so excited to present them to you because once you see them and once you bring them into your consciousness, you're going to start to see the reason why people aren't holding their adjustments are because of their lifestyles. And we can adjust them until we're blue in the face. The way that I explain it like this to my patients, I say, listen, your spine is like hardened clay. If we adjust you, that's like taking your clay and sticking it in the water. What does that do? That makes your clay more moldable. But if you still expose your clay to the same molds and you're still on the computer looking at the same ways and you're still structurally, texting all day long and you're still sleeping with your chin tucked, you are going to reinforce the poor posture, and you are going to end up destroying your spine. This is what I say to patients. And I said, I came up with this pattern that I want to show you, and I'm going to present to you today. And the pattern is based on 3 laws. And the first law is the righting reflex. The righting reflex states that your body posture will adjust to your head position. Again, righting reflex. You basically, body follows where your eyes go. Where if I turn my head this way, my body will go that way. I turn my head this way, my body will go this way. If my head comes forward, you're going to twist and pick up something in your spine that I'm really excited to show you, which is why the reason why I had herniated my disc, not because I had a back issue, but because I had a proprioception issue. We'll get into that in a second. The second thing is Wolff's Law and Davis's Law. Basically, Wolff's Law says that the bone will deposit in the direction of the stress of the tension stress. So if I jump on my leg and I'm only on my right leg, I'll get stronger bone mass on my right leg, and I will deteriorate from the left leg, and vice versa. If I do this with my arm, Davis's Law says that the tissue will develop in the range of the stress. So when you're looking at the body, it describes that our body is like clay. And the reason why we get these degenerative changes in these subluxation patterns is because of their lifestyle. So I'm going to re-share my screen again. I'm sorry I keep going back and forth. I just don't like talking into this abyss of like this craziness here. All right. So I feel like I'm talking to a computer screen, but we'll get there. So when you look here, for all of those of you that are chiropractors, I don't know if, I am sharing my screen so you can see this. So right here, obviously, when I come from the top portion, there's a curve up top. But right at this level, you can see that there's degeneration right at that C5, C6 level. Most of the time, you're going to see degeneration at C5, C6 because this area here doesn't take a lot of rotation. And most of the flexion extension in the body comes from C5, C6. So you're going to see the degeneration here, right? 1, 2, 3, 4, 5, and 6. And then once you start to lose the cervical curve on this side, you'll start to pick up this scoliosis pattern on this right side. You can see that. So right here, you see the severe degenerative change right here at C5, C6, C6, C7. It reverse cervical curve right at that level. Jammed up atlas right underneath the occiput here, and then you pick up a compensation scoliosis. And then let's look at another one. Right here, you have this cervical, you have this curve here, but you lose it right up here a lot higher, and then you pick up this compensatory curve. I believe the compensation curve is happening because of the dural tension that's happening from the loss of curve. Another one right here, you have this straight cervical curve, and then you have this lower back rotation. And what I ended up finding out was that when you pick up that when you pick up that cervical curve, when you pick up the curve in the lower back, compensating for the loss of cervical curve in your neck, that is happening. And this is super important. I remember this from sitting down in my classes back in school at Palmer University, 1998. I remember Maxine McMullen saying this, and this is what I remembered when I was on the emergency room table, hooked up and dilaudid, looking at like purple dinosaurs. And I remember this, her saying, there is a attachment of the psoas major muscle. It's the only muscle in the human body that is attached directly to a disc. And after reviewing those x-rays, I remembered that. And I said, I got to go back and look at x-rays and see if I have a psoas major muscle spasm with an attachment to a disc that's in constriction, that's changing the pressure of the disc, that's weakening the disc, or that's changing the biomechanics that ultimately made that disc herniate. Because remember, even before my disc had herniated, I had so much back pain. And I looked at an x-ray, then another one, then another one. After 1,000, then 2,000. It was so consistent. It was 92% consistent. When somebody loses the cervical curve in their neck, they pick up their lower back curve in their lower back, like a scoliosis in the lower back, or their hips go out of alignment, or the sacrum shifts, and with the compensation psoas major muscle spasm that's weakening the disc. So all of this time, I didn't have a back issue. I had a neck issue because I had forward head posture that was compensating and being reinforced, that I surmised at that point to my sleeping position. And that was my aha. Once I figured that out, I called my really good friend and I presented the information to him. That was Dr. Joe Mercola. And I said, Joe, I figured out this pattern, and tell me if you think it makes sense. And he's like, where can I read it? I said, you can't read it on it. It's something that I'm developing. He's like, well, you gotta do more on this. You got to look into it. Then I saw him at a seminar, and I pulled out some stuff, and I told him something about himself. He's like, all right, I'm convinced. So he flew up to my office. I evaluated him, and I told him that I fixed it by sleeping. I changed my sleeping position, and I started, instead of putting a pillow under my head, because I was always a back sleeper. Well, I wasn't always a back sleeper, but I was a back sleeper at that point. I started stuffing something under my neck. I cut pillows. I would pull all the fill out of the pillows, and I would start jamming the pillows under my neck. Hence, we developed something that's called the neck nest. I'm going to stop sharing right now, and I am going to bounce back to this. So we developed the neck nest. And the neck nest was developed just out of necessity, because I was trying to create different things with my pillow. So you can do the same things that I'm going to show you with your pillow. You can do it with a rolled up towel. You can do it with jamming something underneath your neck. But we were not designed to sleep on our sides. And I know that there are so many people that have tried to challenge this, and they say, well, no, the studies show you that side sleeping's better because of lymphatic drainage. And I have those lymphatic drainage studies here. I have the airway studies here. And then what they say is, no, your lymphatic drainage is better on your side. It's been shown. Studies have been shown. And I said, well, have you looked at those studies? Hold on, where's my little thing? And they're like, no, I read the study. Well, in the study, there's a significant statement. And the significant statement states this, that we understand that the study was done on rats. And we're making the hypothesis that it's better to sleep on your side for a rat, so it's better to sleep on your side for a human. And for those of you, I know a lot of us are chiropractors, but when you look at it, I just want to show you, look at the cervical curve in a rat versus the cervical curve in a human. The difference between a rat and a human is a rat has a reverse cervical curve. So yes, they're designed to sleep, on their side with their chins tucked, or with their head, on their belly with their chin on the ground. We are not. So when you are looking at the research, the fundamental basis behind the research is based on their paradigm or their hypothesis. So they looked at this, not looking at the health of the human spine, the structure of the human spine in mind. And I'm going to tell you, lymphatic drainage gets destroyed when you start destroying and you start reversing the cervical curve in the human spine. So the way that we are supposed to, or the way that we are designed to sleep, is where our weight is distributed over the greatest surface area. I tell people this all the time, and we put programs together. We have sleep quests, and we help our patients virtually sleep on their back to start out 1 to 2 hours a night because it's good spinal hygiene. And this is an Oura ring. For those of you that aren't familiar with it, an Oura ring helps track your sleep. So we can get an improvement in the quality of sleep, an improvement in their HRV, which is the readiness score, which how ready are you for the day, by 20 to 30% by just changing their sleeping position, because they don't toss and turn all night long. I tell people, I say, all right, you want to get a good night's sleep. So I want you to do why don't you do like a little game for me, all right? So go into the position that you like to sleep in. Let's say it's on your side, which 90% of the people like to sleep on the side. And they like to sleep on their side because they feel comfortable, they feel protected. There's so many reasons for it, just like the ostrich sticking its head in the ground to feel safe. But watch TV in the position you like to fall asleep in. And you watch TV in the position you're going to fall asleep in, how long can you stay in that position for? You're only going to be able to stay in that position maybe 20 minutes, a half an hour. Then you're going to toss and turn. So you are setting yourself up for failure based on the position that you're sleeping in, because you can't stay in that position. It's not sustainable. There's something that's called drunken paralysis, which means if you sleep on your side and you're drinking excessively, which I just had a patient come into me this week as a new patient, and they have numbness in their arm. And I said, what happened when you woke up? Yes. How much alcohol did you have? Oh, dog, how'd you know? I had so much to drink. Because your body will toss and turn all night long because your body is in pain. So if you set yourself up to be able to fall asleep in a position that you can stay in 8 hours without moving and not do damage to your spine, you can structurally get changes in your spine. Your patients are going to hold their adjustments better. They're going to be more energetic. They're going to love you. You're going to be able to start, they're going to start holding they're going to be responding to their adjustments and the treatment so much better. And that position is this. When you use a pillow, whether it's a neck nest or, like I said, something that's rolled up underneath your neck, you don't want to put the pillow under your head when you're sleeping on your back like I was for so many years, like this. You want to put it under your neck so your neck is arched back and there's nothing on the back of your head, not like these cervical foam things where all it's doing is supporting the head. You want to use your head as a fulcrum, a weight, and you want your head to arch back over the pillow, in essence, getting distraction in that neck. And what you're doing is you're restructuring that cervical spine and you're aligning that atlas. So if you look here, see this atlas on the right where it's jammed up underneath that occiput, and you look at this atlas right here, in what you can see that there is an alignment, and that's just structurally based on improving the cervical spine with the adjustments while you sleep. So we teach our patients, you adjust, you break up the scar tissue. It's just like taking your spine, your hard clay, and putting it in water. Now your clay is more moldable. Now it's up to you to expose your clay to different molds. So let's go back to this craziness right now. And we will go all the way back through all these. And now, so let's look at this patient. This is a patient that we adjusted. We started getting them to sleep on their back. We started jamming a neck nest underneath their neck. On the left is before using neck nest and being adjusted. This when the patient first started. And on the right is a nice improved cervical spine. Atlas is really aligned in both positions, but they improved that curve. Now this is a good one to see. So you can see on the left where we have this reverse cervical curve right here on the left. And then on the right, the curve is starting to come back. But when you look down in the lumbar spine, you can see from the left one versus the right one, there's less tension on that right psoas major. This patient, yes, is out of pain, was really excited to be out of pain, but what we want to do is we want to continue to have her even sleep on her back, and she and she actually, I don't have the other X-ray. A year later, this was after 6 months. A year later, her cervical structure of her spine, this patient's 43 years old, is even better. She has a better arch, and so it's going to continue to restructure as she continues to sleep on her back. So that, oh geez, hold on, I'm going back and forth. Stop sharing, and then bring this down. Good. So she's going to, so as she continues to sleep on her back and on her spine, what's going to happen is her spine will start to restructure, and she'll pull out that tension. So we do this with our patients. The first thing I want people to realize is that they are a product of their daily rituals. What they do on a daily basis defines their health and well-being. That's number one. They need to understand when they come to our office, they need to understand that they're here because of them, right? They're here because of their lifestyle. So if I adjust them and they go smash their head off the wall, and I adjust them and they smash their head off the wall, and I adjust them and they smash their head off the wall, are we ever going to get anywhere? And then the answer is no. So, and then we explain to them within our report of findings that they have decreased loss of space, which is due to compensation, because as Wolff Law states, if you don't use the joint, you lose it. So when you damage something, that damage heals with scar tissue. Scar tissue restricts motion. And when you restrict motion, the body says, if you don't use it, you're going to lose it. So it starts pulling fluid out of the joint. And just like a shriveled up raisin, your joint space starts to degenerate. So when you get adjusted, what we do is that's your spine becoming hardened clay. Your head's coming forward, your pelvis is rotating. I don't care if you're coming in with a knee issue, a bunion, a plantar fasciitis. It's all because of proprioceptive breakdown, because your head's in the wrong position. So what we need to do chiropractically, we need to break up the subluxations. We're going to adjust you. It's going to be like taking your clay and sticking it in water. And this is all education I do for my chiropractic team also. But it's like taking clay and sticking it in water. Now your clay becomes more moldable. So the first thing that we need to do is we need to expose your clay to a different mold. When we adjust you for about 12 visits, about 4 weeks. We'll adjust you. No changes. We're just going to drop marbles and see how things work. In the meantime, you're going to bring in your pillow. We're going to evaluate it. We're just going to take a look at it. Then after we do our re-exam after 12 visits, now it's time to start restructuring. It's start to use your sleep, your 8 hours a night, to reverse the damaging effect of your modern day lifestyle. So we get you to lie on your back. We start putting a neck nest under your neck. We start having you lie flat. You restore the curve in your lower back. You start pulling the rotation out. You're in proper alignment when you're sleeping. And you only need to start. Here we go. You start in that position for 1 to 2 hours a night. That's it. That's all you have to do. Because people are going to look at it, and you might even be saying, oh, Doc, I can't do that. I'm a side sleeper. I'm a stomach sleeper. You give me a side sleeper, I'm going to give you a hip problem. You give me a side sleeper, I'm going to give you a shoulder issue. Remember, we know that because people are walking around here like this because they're using their pillow too much on this side. Their jaws are jammed over. Their faces are all wrinkled. We're all side sleepers. We all have the same problems. I know that because I had a shoulder issue and a back issue. So we first change the way they sleep. But when you put somebody on 2 bilateral scales, when they're changing, and notice that people typically put more weight on one side than the other. So we need to retrain the brain. So what we also do in our Dr. Sleep program is we teach them to get on a wobble board and start wobbling and start changing their balance at home. So they just go online, they buy a wobble board. They can buy it from your office, doesn't matter. Then they buy a wobble board, and that wobble board helps them rebalance and restructure their brain. Train your brain, get out of pain, put yourself in a nice neutral sleeping position, get that neck arched back. And then the last thing that I have them do is I have them work on their psoas major muscle spasm, on the convexity. They can do it bilaterally, but on the convexity of the curve, and they work through their stomach and they press on their psoas. They release the psoas major muscle spasm. They start restructuring their spine when they sleep, and then they go from they go on the wobble board and they start retraining their brain with a whole new world. It's like the Aladdin thing. It's a whole new world. I know, I'm crazy. Listen, I don't like talking to myself here. I feel like I'm like in the middle of this twilight zone, going back and forth from screen sharing to not screen sharing. I'm going through my presentation like 5 million times, but this is okay. So if you want to join us in our quest, or you want to find out even more information about the neck nurse or how you join our team, we're taking 50 offices to come on board with us, to come down this road to be a neck nurse wholesaler. We haven't opened the program yet. We're not starting until April. When are we starting? No, April, May, June, July, because we're out of stock right now with Neck Nest. But if you're interested, just go to necknest/Chiro to find out more information. You can find out more information with me. You can, you can email me at drmartone, drmartone @necknest.com. Follow me on Facebook. I'd love to kind of get connected and chat and do all that kind of good stuff. As promised, I told you I was not going to be a boring. Well, no, you listen. If I could talk for an hour. I could talk for 2 hours, but I want to respect your time, and that is my allotted time. Well, that is how much time I had set aside. A nice little half an hour talk. Oh, there she is. I knew you were going to come and bail me out. Look at you. Woohoo! How we doing?
You're great. And I love it because nobody ever says I'm going to speak for like 30, 35 minutes and does it.
Yeah, well, I am. Yeah, I'm anal on time. So I really like to kind of structurally stick to where it is, because people might have some questions. If they have some questions, I'd love to answer them and, be respectful of other people's time. We can have time for like 10, 15 minutes of questions. So this is great.
Well, I love it. So we do have one question. They said, what do you recommend is the best mattress for people?
So go ahead.
Oh, and they said super firm coils, memory foam, adjustable base.
Probably as being a sleep expert now and zigzagging into kind of the sleep world, that's a really common question I get. And the way that I explain it is when you get the sleep position down, the mattress becomes less of an issue. So my recommendation is purely a mattress that bends. And a mattress that bends, what I mean by that is a mattress that can elevate. I'm a firm believer in an elevated sleeping position, about 5 to 8 degrees. You can do that with the mattress. You can do it by using, these wedges you can get online, and you can sleep slightly elevated. That will help. But I like at least getting the mattress that bends. So that would be latex or memory foam. Memory foam has a little bit more off-gassing. If you're concerned with that, maybe the purple mattress might be a good one too. But with the latex bed, I think Level Sleep is one that we had recommended in the past. But with the latex bed, then you can use a topper, and you can change your topper all you want. I like down feather beds. The down feather bed toppers usually last about 5 years, and they just put a new feather bed on top. And then that way you get a nice firm support underneath, nice latex firm support, and then you just change your toppers, and that thing will last forever.
Okay. And I'm just curious, like, how long does it take somebody to like retrain to sleep?
Oh boy, it takes a long time. It could take, because there are when a doc comes on, we have this at the Sleep Academy that we're going to put them through, and it educates people on all of this. And then their patients also will get a 30-day sleep program from me teaching them all of this stuff. But so if you just start 1 to 2 hours a night on your back, the biggest thing is going to be the airway, right? Snoring. It's going to be, not feeling feeling exposed, not feeling protected. So we use pillows over our chests. We'll use. So I sleep like this. This is going to be nuts, right? You're going to be like, "Are you nuts?" And I'm going to say, "Yes, I am," but it's because of who I am. So the way that I sleep is I sleep with my own covers. I have neck nest under my neck. I put a pillow over my head. I sleep with my covers like this, and then my arms outside. So I only keep this covered from here to here. Sometimes I'll take a pillow and I'll jam it under my chin. So if I have some alcohol or something like that, so my mouth doesn't fall open, and that's how I sleep. But it takes a long time. But there are different techniques you can use to be able to help you sleep on your back.
Yeah, I'm just curious because, like, I know my daughter who is 4, we used to put her on her back, and within minutes, she would flip to her stomach.
Yeah.
Like immediately. And we go in there constantly and flip her back over, and she still sleeps in the same way on her stomach with her butt in the air, and she's 4.
Yeah, there's it's a protective thing. So get her a and it's tough for little kids, right? Because they don't have the Y as much. But, get them to like put something on their chest, get them like a teddy bear to hold on to, and put stuffed animals on one side and another side, and teach them that they're in like this little channel. And so there are different things that you can do.
Yeah, I'm just thinking because, I mean, like, she's been like that since, and we got her through foster care, but we got her at 6 weeks old, and that is how she's always been.
Yeah, there's a protective thing there. There's a security issue there. I was talking to a guy came up to me at a party. It's like, "Doc, I need help sleeping." I'm like, "We want to do this right now?" I'm like, "What position do you sleep in?" He's like, "On my stomach." I'm like, "Well, you have some sort of, you're scared." He's a grown man, like Jack, grown man. I'm like, "You're scared about somebody coming in and probably killing you at night." He's like, "Oh, how did you know that?" It's like, because you're sleeping in a protective state. So you want to kind of address those different types of things, create like that secure environment, and you put them on their back. You put something, and then there was something else I was going to tell you, but I actually forgot right now. I wanted to say something to you, and I can't remember.
That happens to me all the time.
Yeah, I lost my train of thought. But yeah, those are some things that you can do with kids.
Well, that makes me feel better. Well, then my husband would be great because he does sleep on his back, but he snores, and I hate it. So apparently,
he needs to sleep elevated. I need to lift him up a little bit while he's sleeping.
Yeah, I mean, he's in like tons of sleep studies. They're like, "There's nothing wrong with him." I'm like, "No, there is."
Oh yeah.
He sounds like a grizzly bear in hibernation.
Like a freight train, right?
It is insane. And I used to be the kind of person who slept in complete silence in the dark. I sleep with the TV on to counteract the noise.
Oh no.
I do. It's either that or I'm going to have to start sleeping with my kids.
Yeah, one thing too is basically if you don't know what you don't know. So I tell people to track their sleep. There are different sleep trackers out there. There's the Whoop, there's the Oura Ring. There are different ones, but get something so you can get a baseline of where you are, and then you know what you need to improve. Because if you can't monitor it, you can't improve it. That's kind of based on that's been my mindset and framework from the very beginning.
This has been my favorite webinar so far this year.
Oh, stop it! Don't even say that.
It is. I mean, I can totally see the benefits. I'm not a doctor, but I am a diehard chiropractic patient and groupie. So, like, I totally love all of this education right here. Does anybody else have any questions? Because I want to be respectful of your time, and I love it when I get to let y'all go early. And y'all have to promise to sit at your desk and have one of those breathe in and breathe out moments. No paperwork, no getting on the phone, no walking out of your office. Just take a moment and breathe, because I know that doesn't happen very often. So I don't see anything else. So just know that if you're watching the recording and not on this live presentation, any comments you type in the chat box or email directly to me, and then I will forward them along to our awesome speaker, and he will follow back up with you with an answer. So you said right now the neck nest is out of stock?
Yeah, we've had a difficult time. I mean, we've done a lot of stuff this year. We're on Dave Asprey's podcast, Joe Mercola's, and we've done a lot. So we ran out of everything twice. We have them coming in. They should be in stock in July. They're actually on they're on a train right now. So they should be in stock in July. And then that is when we're going to start our new doctor program. And like I said, if they go to necknest.com/Chiro, they can find out more information. And all they have to do is fill out a form. And then my office will be in touch with them to give them more information.
Awesome. Well, thank you so much for being on the webinar series today.
No, thank you. It's great. I love it. I've been in the profession for 21 years, and it's awesome. I love chiropractic. I love sharing my 21 years of experience and hearing about other docs that have been out there and hearing about their experiences. So it's great. This is I'm glad that I can give back this way.
So quick question. So you're also a speaker. So you speak at lots of events. What events are coming up that I know you're not speaking this summer, but what events are coming up that they could see you live and in person?
They could, if they go to ChiroFest, I will be speaking. That would be the next one that I'm speaking at. I'm speaking at a lot of private events. I'm emceeing an event at Dr. Dan Pomper. It's a cellular detox event. We're doing that one in October. I think Del Bigtree will be there. And then I believe there's another one that I'm speaking at. Yeah, so the next one would be ChiroFest. I would say that would be the biggest, most open to the chiropractic population.
That's too funny. I'm emceeing an event this fall with Del Bigtree.
Are you where?
I'll be in Colorado with him.
Awesome. That's great.
We have been booked at the same events like 2 or 3 times in the last year, and different things have come up that have prevented me from being able to go. So I'm so excited that I'm only going to see him in October. And then after I hang out with him for the weekend, I'm heading to Hawaii.
Oh, wow. I don't think we worry about you at all. So that's fantastic. That's great.
Okay, so one of the docs said he noticed that your demonstration of how you sleep is different than what is shown on the website.
Oh boy, he did. So the person that took that picture, I was not there for the filming. That's actually my daughter. That is a neck nest that is not broken in. So when the neck nest comes, it's a down fill. It has a lot of fill in it, but down fill breaks in. So the way that we have designed the neck nest is that you use it differently from when you first buy it, and then so that there's a break-in period, and then there's the rest of the life of the neck nest. The way that it's shown on the website is that is that my daughter's sleeping on it like this. And that's one of the things that happens is people, they use the neck nest and they're like, oh my God, the neck nest worked great for the first 4 weeks. And then what happened is the fill breaks in, and then the neck nest starts to get more broken in and a lot more flimsy. That is ultimately how the neck nest is designed to be used. So on the site, if you go to necknest.com, you'll see how to use my neck nest, and it's break-in period. Then it's a 1, 2, 3 step. Neck nest goes flat on the table or the bed. Then you grab the edge of your neck nest, you lift it up, and then you put it right underneath your neck, and then it wraps around your neck. That's actually a good catch. That is something we go over in depth in our doctor program.
Excellent. Well, thank you so much. So just a reminder, everybody, we do have a webinar next week with Dr. Marty Kotler. We're going to be talking about how to appeal denials and scrub EOBs. If you have any additional questions for Dr. Martone, again, you can email me at Christy@ChiroHealthUSA, or you can email him since he did provide his email address. Either way, we will make sure that those questions get to him and get answered and get back to you. I want to thank everyone for taking time out of your busy schedule to join us today. And a very special thank you to Dr. Martone for taking time out of his schedule to be a presenter on our webinar series. The recording for this webinar will be posted on the website and available starting in about an hour this afternoon. And again, like I said, if you have any questions, if you're like me, I always think of a question like the next day or later that night when I'm processing info. Again, just send me an email and I will get y'all connected to get those questions answered. Everybody have an amazing rest of your week, a fabulous day, and I will see you next week, same time, same place.